Well, this is an exciting session, and I'm really looking forward to hearing these next set of presentations. We're going to be hearing from a couple of folks on some interesting topics here. And the first presenter is Sharon Reed, who's going to be speaking with us about emerging infections and border health.
Thank you. So now we're going to go to some specific health issues. And what I'd like to have you all think about is how we can really get ahead of emerging infections right here in San Diego. And this is an overview of emerging infections over the past few years. What I want to point out is right here in San Diego is the current influenza strain, which has actually caused the pandemic in 2009, was identified first in San Diego. It was our Navy colleagues, but we want that to be us next time, and it can be very easily. Emerging infections are a combination of both newly involved strains, for instance, new drug resistance, pathogens that have usually are zoologic and have moved into humans for the first time. That was how HIV started. There's SARS we all heard about. The latest is a Middle Eastern coronavirus that is very lethal, like SARS, or pathogens that are dramatically increasing in incidence. If you read the paper at all, you know about the problems with Clostridia difficile, E. coli 0157 in our food supply. So we have a number of strengths, many strengths at UCSD. First, I'm lucky enough to be head of a really state-of-the-art diagnostic microbiology laboratory, and I presume you all get your health care here at UCSD, and if you ever have an infection, we're here for you. And it's a great new facility, even with BSL-3. We have a broad range of faculty in diagnostic microbiology and infectious disease. We work with our infection control teams in the hospital. We have strong community partners, the medical examiner's office. We work closely with San Diego Public Health, our colleagues at Naval Health Research Center, the ones that found that influenza, and the Ventnor Institute, just to mention a few. So the goals of this center that we want to develop will promote the latest diagnostic methods so that we can detect and discover new infections as they're happening. This will improve patient care, but it'll also expand our capacity to make diagnoses and translate this into translational research opportunities. So for starters, we're going to develop universal PCR primers so that we can diagnose bacteria from any tissue. Fungi and mycobacteria, we have just within the lab there multiple sequencers we can use. We want to build into genomics. There is a clinical genomic lab that we can use there, obviously, plus all the exciting things going on with campus for deep sequencing of newly resistant strains so that we can identify these mechanisms of resistance early. We also have faculty members who are charged of translational virology course. So, we no longer worry so much about culturing viruses. We just want to get them to do their entire genome so we can sequence them. We also have a big effort, obviously, in the microbiome, and we have the capacity to characterize that in human species, to find the difference between those susceptible to emerging infections and those that appear to be resistant. Other things that we just have, and we will use this to diagnose your infections, there's a mass spec specific for infectious diseases, and we're using that right now in the micro lab for a diagnostic, so it dramatically speeds up our ability to do that. Right now it's from culture, but we're working at doing this right from clinical specimens. Many of the emerging infections are from animals, obviously, and we have a number of colleagues who are veterinarians, and we will work with them to look for emerging zoonotic diseases, the spread of antibiotic resistance, particularly from animals. And we're looking then for translational ways to make this happen. We'll hear about, drug development, which will be an important part of it, drug discovery with SIO. Stephanie showed a picture. This is the first generation of this small-scale diagnostic device because I've been working with it since the very beginning. but we can use something such as this for the latest diagnostics to help studies, like in Dr. Strafty's unit, for STDs in Tijuana. So we can really branch out these findings through a lot of translational studies. And to do this, we have a core, but we want to go beyond that. So we look to multiple schools and departments for a way to build on our diagnostic efforts. So thank you. Oh, of course, yeah. Mm-hmm.
How are you using the gut? What are you doing about sequencing the gut microbiome first? You use 16S or metagenomics, and then how are you using it to understand the susceptibility?
Well, this is a translational project in the future, obviously. I mean, Dr. David Pride's my associate director in the lab. He's focusing, his own research is on viruses, as you know, in the oral cavity, that can actually potentially be carriers of antibiotic resistance. So these are potential areas that we look to build into. Right, thank you. Oh, sorry.
It's a question about the structure of.
Well, it's new. It's just proposed. We're starting, with potentially within our department in the diagnostics, and then we look to build out, right?
An emerging.
An emerging.
Research
Yes.
and translation initiative.
Right.
Is that right?
Exactly.
Thanks.
Thank you.